very good evening to all the viewers. My name is Richa, and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a women health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, the One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out the first varicose culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines, and currently we are the major player in human vaccines. Leader in ARV segment and present in around 50 countries. Three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. Coming to our vision, mission, and values. Our vision is shaping global healthcare by spearheading the One Health Initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abhairab in an eco-friendly pack, and with this we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and has totally revamped it and gave private infrastructure to these government schools. And with our intervention, the strength of these two schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutrition supplement to over 1600 school going children of Telangana and Tamil Nadu. Also, we have facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. To get more information about Human Biologicals Institute, you can visit www.indimmune.com. Our toll-free number is 1-800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Insta, and Twitter. Also, you can go through our unique initiatives on fight against rabies at www.fearlessagainstrabies.com and everything you want to know about the women's health at www.pubertytomenopause.com. I welcome you all to yet another topic of discussion, as well as an interesting topic, I can say, like how to manage diabetes during pregnancy, with a very renowned gynecologist from Port Blair. She has joined with us. I would like to introduce you all to our today's expert and consultant, Dr. Devyani Agrawal. Dr. Devyani is a young and enthusiastic gynecologist currently associated with Apollo Clinic, Port Blair, Andaman Nicobar Islands. She has performed various laparoscopic surgeries and has keen interest in high risk pregnancy. Dr. Divyani has published various articles in renowned national and international journals. She has also been a reviewer in various journals and has done many paper and poster presentations at national level. She has been co-author to renowned authors of book like High Risk Pregnancy. She has been guide to many clinical pharmacy students and has delivered talks on various topics across the nation. I wholeheartedly welcome you, Dr. Divyani, to our
Thank,
We Talk Do You show.
thank you for the kind introduction, Richa. So, carrying forward with the today's topic, which is diabetes during pregnancy, which is a very common condition we face during the pregnancy. And henceforth, seeing the rise, even the FIGO, which is the International Federation of Obs and Gynae Society, has coined the term hypoglycemia in pregnancy, which includes both the pre existing diabetes and the newly diagnosed gestational diabetic cases. As such, if we talk about our India, the prevalence of the disease is about 17.7%. We see this increase in prevalence because of changes in lifestyle, the dietary habits, older age at the first conception, because nowadays the women are quite in the working era, the common problem which every female is facing, like PCOS, obesity, and definitely of the sedentary lifestyle or decreased physical activity. The stress level has also contributed to the diabetes. But the good part is there is increased detection because of the awareness and the easy testing techniques. As such, pregnancy itself is a diabetogenic state, as there is increased insulin resistance secondary to the placental hormones. International Diabetes Federation in 2019 stated that 1 in every 6 pregnant women has hypoglycemia in pregnancy, out of which 84% is GDM, that is the gestational diabetes. In the subsequent pregnancy, 41% of recurrence is there, and one third can turn into metabolic syndromes. The increase in the case is so vast that even the government of India in 2018 has incorporated gestational diabetes diagnosis and management into the antenatal care packages. But government of India has also given a protocol of diagnosing it, that is DIPSI, Diabetes in Pregnancy Study Group of India, in which we ask the patient to drink 75 grams of glucose, irrespective of her fasting state, whether she had meals or she didn't have meals, in dissolving in 300 ml of water. The intake has to be into 5 to 10 minutes. And after that, she is restricted from passing urine and going for the better results. After 2 hours of it, the postprandial sugars is taken into account. If it is less than 140, she is fine. If it is more than 140, she is definitely diabetic. We perform this test on the very first visit of the pregnant woman and repeat between the 24 to 28 weeks period of gestation. But why are we subjecting it to pregnant women? Why? This is a major question which all my viewers are surely into increase, because diabetes causes a lot of maternal and fetal comorbidities. Mother is more prone for preeclampsia, which is increase in hypertension during the pregnancy. She undergoes a lot of infection process like urine infections. There is chances of obstructed labor, traumatic deliveries, increased chances of LSCS, metabolic syndromes, and later can develop even type 2 diabetes. In the fetus, which is just the newborn in the womb, can undergo abortions in the initial stages, develop congenital anomalies, moreover of the cardiac anomalies, have stillbirth, that is the death during the delivery, or can die inside itself. The baby can be bigger in size, which is known as macrosomia, can be premature. This is the part where the baby can grow more. But on the other hand, even diabetes causes a prematurity in IUGR level, which is even more dangerous because the blood supply to the fetus is decreased. During delivery also, shoulder dystrophia, clavicle fracture to the baby is quite common, which prolongs the NICU stay. When the baby is born and the neonate is in NICU, there are chances for respiratory distress syndrome, baby's glucose to be low, lower calcium levels and magnesium levels, prolonged NICU admissions, increased bilirubin levels. Even the child in the later stage can develop type 2 diabetes, obesity, and metabolic syndrome. Hence, it's very important that throughout the pregnancy, we keep mother under check. So during the first counseling, like the first very counseling, we want the female to come before and have a pre-conceptional counseling. In the first trimester, to have routine ANC checkups, take folic acid supplementations, undergo NT-NB scan at 11 to 13 weeks. In the second trimester later, to undergo the quadruple test, to undergo the congenital anomaly scan, which is the anomaly scan done, which is mandatory by the government itself from 18 to 20 weeks. And later on, a fetal 2D echo is a must for a overt diabetes woman at 24 weeks because a major of the cardiac anomalies can be detected during that period. Subsequent ultrasounds is required for the growth of the baby and the liquor, which is the water in layman language around the fetus, to be noted because there are chances that it can increase, which may later lead to cord prolapse, which needs immediate cesarean. For all this, we have to manage the patient once she is diagnosed. So early detection is the key to it. We do medical nutrition therapy and exercise. We tell patients if still not controlled, we go with the oral hypoglycemic drugs and insulin. The preferred insulin to this is definitely insulin is the first choice. Even if the mother is coming pre-conceptional, we switch on to insulin. But the problem with insulin is the hypoglycemic. Plus, the patient is not compliant. They have big time problem injecting to themselves. So OHA has built up a role. The two oral hypoglycemic drugs which is accepted is glyburide, given as 5 to 10 mg BD, and metformin, which is started at 500 mg BD and can be given maximum to 2 grams per day. In insulin, we start with the normal regular insulin, which is the Ectrapid. If unable to decide the dose, we can go with 4 units pre-meal, that is before breakfast, lunch, and dinner, and accordingly titrate with the continuous sugar monitoring. And during the labor, it's the duty of the obstetrician that they keep their patient under vigilance, omit the morning dose, have a planned and discussed way of carrying on the delivery. All the risk to the mother has to be explained, and her journey to the postpartum period and future has to be discussed clearly with the patient. This will definitely help a woman to get through the diabetes during pregnancy without much concern and stay happy.
Yeah. Thank you so much, Dr. Devyani. In a very, I can say, elaborative way, you have explained like how the clinical presence of diabetes could be, and how what are the treatments available, and how do you actually handle such patients, I can say, in clinic. Dr. Divyani, for our viewers, can you just explain in a simple way, like the difference between, I can say, type 1 diabetes, type 2 diabetes, as well as gestational diabetes? Because most of the people, they get confused with what is gestational and what is
Correct.
type 1 or type 2.
Yeah.
Over to you, Doctor.
Thank you. In type 1 diabetes, it is insulin dependent. Insulin production is not enough to get adjusted to the glucose level in the body. It is mainly genetic, and our pancreas, the beta cell especially, is not able to secrete enough insulin for the body. Hence, what we find this condition generally in the youth state because it's mainly an autoimmune and a genetic problem. In the type 2 diabetes, it is mainly the lifestyle modification which we need. It is a lifestyle related problem. It is insulin independent. In this case, the insulin in the body is in sufficient amount, but either the uptake of the cells by the insulin or there is an insulin resistance in the body, creating hypoglycemia. Whereas in GDM, it is first time detected or the onset is during the pregnancy, mainly detected during 24 to 28 weeks. So that is only because of the diabetogenic state of the pregnancy where we see a hypoglycemic state.
Dr. Divyani, can you just elaborate in a little bit, I can say, for gestational diabetes particularly, how it is managed?
Okay. So management of gestation, as I have mentioned about the DIPSY protocol, when the female first visit to us, the very first visit, we do the DIPSY protocol, that is give 75 grams of glucose and do after 2 hours her postprandial sugars. Now, once we do that, which is repeated later at 24 to 28 weeks, if negative before. So in cases of PPBS, which is less than 140 mg per deciliter, we repeat monthly base or later on the pregnancy base and keep her under vigilance. But if it is more than 140, we advise first a medical nutrition therapy and exercises to be done. And post 2 weeks after that, we repeat her 2 hours later postprandial sugar. If the sugar is under control, that is less than 120 mg per deciliter, we ask her to continue with the nutrition therapy and exercise and follow with us on a monthly basis. But if it is more than 120, then we have to start with the drug therapy. That is our oral hypoglycemic drug and the insulin. Though insulin is first preferred, but because of the non-compliant, we go with the oral hypoglycemic drug. So basically, we have to start metformin after 20th week. Ideally, the best what we have got into our studies. So in the initial stage, we adjust the dose of insulin and switch over the patient to the OHA, mainly to the metformin. When we are starting insulin or OHA, we do third day FBS and PPBS every 3 days till her target blood sugar is achieved. That is, her fasting blood sugar should be less than 95, and after 2 hours of her food, it should be less than 120. So supposingly, if she is on insulin and we find that her fasting sugars is more, then we increase the dose at the midnight, that is the pre-dinner insulin, by 2 units every day of monitoring and getting into the PPBS. If it is the afterwards, that is after food, if her sugar levels are more, then we increase the pre-meal insulin. And we just increase by 2 units every time. And on the third day, again, we repeat FBS and PPBS till we achieve the targeted, as I mentioned before. So we need to have that target. Definitive role of exercise and diet is there, and we continue with that.
Okay. Dr. Divyani, if suppose pre-existing diabetes is there, so to such patients, what are the suggestions or how do you counsel that patient that how she can take care of herself during gestation period?
See, pre-existing diabetic patient should definitely consult a doctor before planning for a pregnancy. She has to have a proper glycemic control before she becomes pregnant. That is the HbA1c, which is the glycosated hemoglobin we do, which states about the 3 months of good glycemic control. If it is less than 6.5, the chances of having a malformed baby or having congenital anomalies are lesser. But if her HbA1c is more than 10, we definitely ask her not to conceive right now and better to have a glycemic control, as the chances of having congenital anomalies increases by 9 folds. So the chances increases a lot. Even we have to know her welfare condition, the overall welfare condition. That is, we know diabetes causes a lot of organ damages. So we have to check for her renal condition, her heart conditions, and definitely for her retina in the eyes, whether the eye damages are there. Because if she continues with the pregnancy, the damage to her retina will increase further. So fundal examination is done before. She is explained about to have a proper nutrition and diet before that and have good glycemic foods with lower index, that means, plus folic acid supplementation, which is there. And we surely explain her about all the malformations that can occur in the baby, difficulties during delivery which she can face, and if she had any problem in prior with the infections and everything, we ask her to control all the infections, especially if she is even prone for rubella infection, which causes rubella syndrome in the baby in the initial first trimester. So we screen for all this and then prepare a mother for a healthy baby to be delivered.
It means, Dr. Devyani, you strongly recommend preconceptional counseling, I can say, if a lady
Yes,
is diabetic.
definitely, yes.
Yes. Dr. Devyani, when you talk about, malformations or fetal abnormalities, which you are talking about, so
Hmm.
what are the very, I can say, commonly occurring malformation or these kind of complications which a lady can face? A little bit on it, so that, we can sensitize our viewers that how important it is.
Correct. So in the baby, if I come about, so baby mainly it affects the cardiac system. So there is tetralogy of Fallot, the septum defects, the malformed heart, the holes which are supposed to heal at correct time need not get it, skeletal deformities, neuromotor related problems. If there is fluctuating sugar levels during her pregnancy, then the mental development of the baby is also hampered. Plus, because sugar levels have effect over the baby's pancreas and livers and fat tissues, the baby later faces problems like metabolic syndrome, obesity, type 2 diabetes when they are born later in the life. So all these problems are faced by the baby. If we come to the mother, okay, she is prone for the infections throughout her pregnancy. The baby can be either undergrown or overgrown. There can be a lot of water, which we tell as IUGR and macrosomia in our medical terms. So in both the cases, her chances of not getting delivered normally and turning up into C-section is more. So operations is more. Plus, later on, those operation sites can get infected also because of sugar levels. Plus, even if we are trying to deliver normal or even during C-section, many times the shoulders which are there gets broadened. So because of that, they get obstructed. So babies have difficulty in breathing and coming out. So taking in this many times over here, the clavicle fracture happens and the nerve palsies can be there, which again the baby has to be under the strict pediatrician care.
So, Dr. Divyani, like you have recommended for preconceptional counseling. So, does gestational diabetes specifically, I will ask, just does this gestational diabetes continues postpartum? One thing. Also, doctor, if it is continuing, in case, so what all precautions a lady should take during lactation period? Or if she's pre-diabetic as well, so what all should, she should take care in her nutrition or lifestyle or whatsoever modifications required during lactation period as well.
Right. So after the baby is delivered, the mother is absolutely free to breastfeed the baby. She should not stop breastfeeding the baby, which is very, very important. Many people have this misconceptions that we should stop breastfeeding, there will be increased glucose to the baby. No, you have to breastfeed for the baby, otherwise baby will have hypoglycemia episodes. Secondly, she has to take care about her wounds, let it be LSCS, that is C-section, or normal delivery, which may be instrumental or traumatic. As such, glycemic control, in particularly GDM, is very good. She doesn't need insulin or any medications post delivery. So we don't advise for any medications as such. Apart from the over diabetes or pre-existing diabetes, which we start from the third day when she is allowed with a good full meal. So on the third day, we do her fasting glucose and 2 hours post PTBS. Depending on that, we decide whether to start back on OHA, that is oral hypoglycemic drugs, or not. Generally, GDM doesn't require any intakes. We again repeat at 6 weeks follow-up postpartum. We repeat the same test again with a 75 grams of glucose. And we see her good glycemic control. If it is poor, then we start her on the medication. If it is good, well enough. Then on the yearly basis, every 1 year, we do her fasting sugars and 2 hour postprandial sugar levels for 3 years. So yearly basis, we follow her for 3 years. And if it's all normal, then after that, every 3 yearly, we do her same test, FBS and PPBS. And we follow her, because the tendency of getting into type 2 diabetes is more once she is becoming a GDM.
Thank you so much, Dr. Devyani, for giving us such an elaborative explanations, I can say, and it will be very very helpful for all our viewers who are there, joined with us, or who will be seeing our recorded video. So, Dr. Devyani, one last question, which is very common amongst most of the diabetic patients, whether it is related to pregnancy or not. It is about nutrition, Dr. Devyani. So,
Yeah.
any particular, I can say diet pattern or any particular items a lady can consume during pregnancy or during lactation period so that her glycemic levels are controlled.
This is a very good question. Many people, many patients have this doubt. Even our dietitian who is trained sometimes come out and ask me this question. So definitely, nutrition has a very big definitive role with exercise. So exercise of 30 minutes in the morning and evening does the work. She has to do a mild brisk walking. For nutrition, we have to have a knowledge that we need a carbohydrate controlled meal plan. So according to the BMI and her lifestyle, we on the calorie intake. So if the patient is of very low BMI, she is underweight, we give about 35 kilocals per kg per day. If a normal BMI, then we give about 30. And if it is she is obese or she is overweight, we give about 25 kilocals per day. Depending whether she is a heavy worker, sedentary worker, again we give her nutrition as the calorie requirement during pregnancy increases by 350 and increases as the pregnancy advances. And lactation, because she is breastfeeding, it increases. So generally, we keep this proportion that carbohydrate to fat to protein. We have a ratio of 60 is to 20 is to 20. So if we come to the carbohydrates, we prefer mainly the complex carbohydrates, which includes like oats, bajra, jawar, ragi, whole grains, the vegetables and fruits with the skin, fruits like orange, pear, guava, vegetables like peas, beans, broccoli, and definitely no less of sugar or no sugar depending on her glycemic control, and no maida or refined flour, no junk foods, which is the Chinese foods and oily foods which we are having. And when we come to the proteins, we need good amount of like proteins, because protein requirement again increases in the pregnancy and is required for the mental development of the baby. So milk and milk products, chicken, fish, eggs can be had by the female. In the fat also, saturated such as ghee, butter is allowed to the patient. Vegetable oil, palm oils are allowed to the patient. She need to have a very high fiber rich diet, because fibers give a feeling of gastric fullness, and it also decreases the glucose uptake by our bloodstream. So fibers are very good, like false seeds, carrots, apple. So all this can be taken by her. She has to know that she needs to have three major meals, that is breakfast, lunch, and dinner, and not stay empty for longer time. So two snacks is mandatory. She should have small amount, in the ratio of 60-20-20 also, that she has at least two portions of dal, one portion of enough carbohydrates, vitamins, and along with definitely the routine antenatal medications. This will provide her a good control.
Yeah. So thank you so much, Dr. Devyani. Now it's time for taking some question and answers, Doctor, if it has come from our
Sure.
viewers. Let me just check. Doctor, one of our viewers is asking that she's 6 months pregnant and she's finding low glucose levels every day in the fasting. So, what she can do to control those glycemic levels?
It is very important whether she is on oral hypoglycemic drugs or insulin. If it is insulin, then we have to decrease the insulin units over the night period. And whenever she is getting this hypoglycemic episodes, it is very essential that she keeps glucose with her and take about three spoons, which is about 75, not 75, 25 grams of glucose, and mix it and drink immediately. Keep some chocolates, sugar content near her and have immediately. And after half an hour, 15 minutes to half an hour post taking that glucose, she has to eat chapati with some sabji or rice dal, a bit of rice with the dal, so that her glucose levels is maintained. And definitely visit to her doctor and rechange on her insulin levels.
Okay. Dr. Divyani, we are having another question from Bihar. Uh, she's asking that if I am diabetic, will my child be also diabetic?
Yes, definitely. There are chances. I won't say zero chances, but in future, definitely there is about 2.5 to 3.5% chances of baby developing type 2 diabetes, obesities, and intolerant glucose level, impaired glucose tolerance. So it's very necessary the baby in the earlier lifestyle itself is kept away from junks and refined flours and got into a proper lifestyle where the chances decreases. But we know as we are advancing with this global situation, we are prone for this adiposity damage, that is obesity and type 2 diabetes. So initiation of a good lifestyle in your baby will definitely reduce the percentage.
Doctor, we have another question coming from Silchar. She's asking that she had a C-section and her baby is 2 months old, but she's doesn't get time to have any exercise. What other way she can control her diabetes? Any
Okay, so
suggestions? Because this is very common, doctor, that mothers don't get time for themselves.
see, the one thing is the mother herself have to learn how to get time with the baby. And babies are the best form to have exercises. Babies make us exercise. you know, so
True.
definitely one is a good diet. As I have already mentioned about the food diets, have a proper appointment with a nutritionist or a dietitian, make a chart over it and start following a diet. Another thing is when she is feeding the baby, she feeds the baby, and when she has to do the pampering, like so that the baby doesn't take back ingest milk and all, she can have a walk over those periods. So once she walks, that is equivalent to exercise. 30 minutes, anyhow, 15, 20 minutes, a baby needs it. When baby needs a nap, she can again have a walk. And I think babies over make them to do more exercise than even the recommended one.
True. Doctor, we have another question. She's asking that she has got vaginal stitches, and even after 12 days, there is some water coming out. Yeah, maybe the stitches are not healed properly because of
Right.
diabetes, could be.
So
So, how she can handle?
diabetes have poor wound healing, but she should again visit to the doctor, see that her sugar levels are under control. Very important. She's taking her medications on time. If the water content, it depends on what sort of water content it is. And accordingly, we start on the antibiotics so that the microbial control is there. So she can visit, apply some ointments, take antimicrobials, and maintain a good diet. That will do. And local hygiene.
Yeah, that is very much essential.
Yes,
Uh, Thank you so much, Dr. Devyani. For now, we had only these many queries. Later, also, if we get any query, I'll definitely come in contact with you. So,
surely.
thank you so much, Dr. Devyani. Wholehearted thanks to you for giving us your valuable
Thank you.
time and such a beautiful, I can say, conversation we had today. So,
Thank you
with
so much for having me here. It was pleasure to discuss a topic which I think every female wants to know, and it's important in today's surroundings to understand diabetes because almost our it's like an iceberg phenomena. We know many people are diabetic, still doesn't know, and they end up into complications, diagnosed late. I think this will make them aware and also ease them out that there are precautions, there are treatments. Just follow them, and it will be
just
all
follow.
good.
Correct. And always they should, listen, I can say, at least to the instructions which are given by their gynecologists.
Correct.
Thank you so much, Dr. Devyani, for being here with us today.
Thank you for having me, Richa.
Thank you. A wholehearted thanks to all our viewers as well, who have been continuously with us session over session. So, once again, I can say on behalf of Puberty to Menopause, a Women Health Awareness Initiative by Human Biological Institute. A very wholehearted thanks to all. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life. And also, you can follow us on Facebook, Twitter, Insta to get more updates on health and live talks with us, uh, experts or expert with all expert doctors across the nation. Till then, choose better nutrition, better lifestyle, and build your fitness. See you all again on yet another interesting health topic in the next session. Till then, good.